Hi, this is Dr. Meret, and I'm a clinical psychologist. Let's talk about trauma response. A lot of what we call trauma symptoms or trauma responses are actually learned skills. So it's not a defect, it's actually a skill that we've developed because we've experienced something that was maybe overwhelming or something that was extremely difficult and traumatic. When you're in that kind of environment, your brain asks, how do I survive this? And then it builds a whole pattern around it. Think of a soldier in combat, being hypervigilant, constantly scanning their environment for danger, noticing every single sound, every single movement. That's what helps keep them alive. So that's not a dysfunction. That is a very important skill that is necessary in order to survive that environment. And this is not true just for extreme cases like combat. A child growing up in a very unpredictable and a very unsafe home might learn to constantly read other people's moods, to stay quiet, to keep the peace or avoid any kind of conflict or threat to their safety. So in that environment, that awareness helps them stay safe. So this is where it gets a little tricky. Those responses don't just turn off when the environment changes. So later in life, that hyper awareness might show up as anxiety. It can show up as people pleasing, as always being on edge or being easily startled, even when you're no longer in danger. So what once protected you can start to feel exhausting and even harmful. But that doesn't mean that the response is inherently bad. The goal of therapy isn't to necessarily erase that skill. It's to help your nervous system realize, I'm not there anymore. I'm no longer under threat. I'm no longer in a dangerous environment. And also to give you flexibility so that you're not stuck in survival or fight or flight mode all the time. Because that same awareness can help you read the room. It can help you build strong relationships with other people. It can help you develop deep attunement to other people. So the difference is you're choosing when to use it instead of it using you. So your trauma response, that skill, was once your protection, and healing is learning when you no longer need it and how to use it in a way that is more effective, how to use it in a way that can actually benefit you and not harm you. All right, I hope that helps. Take good care. Bye-bye.